We're seeing more children infected than we've ever seen before for a couple of reasons. Number one, the Delta variant is more transmissible. It's 1,000 times more transmissible than the original variant, probably 100 times more transmissible than the Alpha variant. And so when that's the case, you're going to get more people sick. And it looks like, unlike earlier, is that, our younger kids are getting sick. So when you get more younger children sick, well, that means there's going to be more younger children that are going to end up in the hospital. Now, the younger children are also getting more likely to be sick is because they're not vaccinated. And we also have learned, right, in this part of this surge in the hospitals, it's 95% unvaccinated. And so these are individuals who don't have the opportunity to get vaccine. And then lastly, we know that teenagers are still coming in as well, and some of them aren't vaccinated. So it's the continued, that's the continued struggle, and that's why we're seeing it. Whether it's more severe or not, I don't think we know, but there is no doubt that we're seeing more. I mean, we're seeing more. I mean, the pandemic task force focusing on children being as many in the hospital. We have more children in the hospital now than we had during the surge in the wintertime. And you just mentioned it, right? We don't have yet the number of cases we had in the winter, though I can't say we're not going to get there at what we keep seeing on a daily basis. To protect our children during this time and during COVID-19, one of the biggest things we can do is vaccinate. And I know if we can vaccinate the people around our younger children who can't get vaccinated, you're going to kind of put a cocoon around them even more so. So that's one of the big things is vaccination matters and will matter when they can get it, which is going to be a bit, unfortunately, it's going to be a little bit longer than we were hoping, probably late fall. But we can vaccinate and then layer on after vaccination, the masking, use some distance, but really keep people home when they're sick. These sorts of things will help even protect the younger children who can't be vaccinated at this point in time. We learned in 2020-21 school year that the way to keep our schools safe was to do the quote unquote mitigation strategies, one of which being probably one of the most important is wearing a mask and wearing it effectively. In addition to wearing the mask also includes staying home when you're sick, washing your hands, keeping some distance. So we've learned it doesn't have to be as far as we thought. And doing those things will keep you safe in school, when we didn't even have a vaccine. And we saw that. And so, yes, I mean, I strongly believe at this point in time with the rising cases that we're seeing that we should be masking. And we know that even the vaccinated can get sick and potentially could transmit it. So I think at this moment in time, with the rise in cases in our children's hospitals, not only in St. Louis, but in all parts of the country, I can tell you, I have colleagues there, we need a mask. That's one thing we know, and use the other mitigation strategies right now because they work and we've seen them work. Masks have been shown to work and prevent respiratory infections. I think it was demonstrated in just looking at two studies that would say, one, when you're in a house and you bring in COVID-19 where you don't wear a mask, transmission was 50% of the people in the house were going to get it. That was the original stuff, COVID-19. We look in a school where, let's mind you, you're kind of on top of each other in many places, and you wear a mask, and this has been shown in St. Louis, Springfield, Missouri, North Carolina, and all across the country, and you wear a mask, the transmission rate of COVID-19 was like 1%. I mean, that demonstrates this is part of what worked. And I think that's one of the many studies that have shown this throughout this. And I think that's the piece. Now we're going to continue to hear people say masks don't work, and that piece. And the science and our experiences and individuals' experiences have demonstrated that. Even those who've had COVID-19, go get vaccinated when you're not infectious, because that's going to protect you against future variants as we continue to see how effective vaccines have been against variants, the vaccinated are against variants. Do that, keep the masks on so that we can all, prevent any infection happening even among the vaccinated to get us down to a rate of disease that's lower. Once we can do that, then you can talk about going back to what June was like. I mean, how awesome was June? I mean, we can get there. We're just gonna have to do some of the things we just don't like to do, but they're effective and they're helpful, and they will make the end of 2021 and 22 much better than they are currently. And let's support each other. Let's wear a mask for one another, for ourselves. Let's stay home when we're sick. And we're going to get through this surge, but let's just do it so we don't have more kids in the hospital, have more of our loved ones in the hospital. And then we'll move into the next phase of this and get more people vaccinated so we don't have to experience this stuff anymore.